Here, Senator Perry, you have the panel.
Thank you, Mr. Chair, and to Ash, and I appreciate you. You're always ready. You come in and you do an admirable job for advocating. Here's a question, set the politics aside, and this is strictly, and I know you're not a physician, but obviously there are unique differences between male and female at birth that our medical system addresses it throughout the course of that individual's life, you know, breast cancer being one of those issues, or et cetera. So do you know if a trans woman or a trans male enters a physician's office if they're treated as their biological sex? Because that's where the DNA and the chromosomes and things, for instance, women don't have prostate cancer. So do you have, because when we talk about safety and studies and demographics and things, as our medical profession looks back and tries to do trend analysis and treatments and statistical research and stuff, so does a trans woman in a medical setting get treated as a biological male for treatment? Or I'm just asking, if you don't know, you don't know, and that's okay too. I'm just, you know, it's a foundational issue, right? That doesn't change through the life of a person.
I understand what you're asking. If the doctor's doing their job right, they treat the person as trans, and so they address the person by their name, by their pronouns. They get that medical history if there's been any sort of medical treatment that pertains to this person's gender identity. And then from there, you figure out, you know, exactly, you know, obviously this is a very intimate relationship, the doctor and the patient, but that doctor does have to figure out, you know, what this person's body is like and what treatments they may need and what kinds of, as you said, diseases they may need to look out for. But it doesn't have to change the way that that patient is treated as a person, as, you know, per their gender identity. And so to answer your question, it's true that cisgender women are very much not going to be getting prostate cancer. Transgender women, they might. And that's simply the reality that we live in right now, and it doesn't have to be a big deal. A lot of doctors have figured it out already.
So based on that, it's possible for people that trans fully, surgical and other treatments all the way into the system, and what I'm hearing you say is it's possible they would not have exposure to those diseases that are unique to genders at birth, biological sex.
I think you may be misunderstanding. When I say transgender women, I mean somebody who's transitioned from male to female. And so even though that person has made that transition, they could still have prostate cancer. That's correct.
Right.
And in that case, the doctor doesn't just start treating that person like a man. What they do from there is they treat their patient the way that they want to be treated. They're just also making sure that that person is not going to get prostate cancer.
And with that, that's what I'm going to. There are legitimate differences at birth that can't be changed and that demand, not just in medical settings, but other settings in life. So I guess it's complicated, and I appreciate your perspective, but the reality of the day is there are unique differences that from a medical perspective, it's important to know biological sex so that it doesn't distort results in test and research and treatments in those environments.
And that may be, but that doesn't change that we can still treat people the way that they want to be treated and treat them as who they are.
Yep, go ahead. Get that microphone so we can hear you.
Thank you so much. As the Transgender Education Network of Texas, we've been involved in many study bases in terms of healthcare. Senator Perry, to your point. I would say that in talking to medical researchers, medical students, things like that, having trans people as a population that they can care for who they are actually makes their healthcare better because they're able to see differences, because they're able to catch things differently than maybe a cis male or cis female. It actually advances what you're talking about. I am from Houston. I understand like medical capital, especially worrying about cancer, right? And what we've learned really since 2015 is that when trans people are able to be a part of studies and things like that, their research actually goes further because every body is different, but the ability to see differences in a spectrum of people, right? Thinking about age range, so you have young people, you have elderly people. If we're talking about cancer, that affects their bodies differently. It's the same concept such as that. It's the ability to have a larger spectrum.
Thank you. Did you want to respond to Senator Perry's question? Please go ahead.
Hi, Senator Perry, so in addressing the question you posed, so yes, a transgender woman could get prostate cancer. However, within the medical literature and what the emerging data is showing is that when we look at the hormonal milieu of a transgender patient, after a certain time of being on stable hormone therapy, legally prescribed, supervised hormonal therapy, after an administration of 3 to 6 months at stable dosing, and essentially without additional comorbidities, that we see a change in laboratory values to reflect the expressed gender. In other words, so a transgender woman on hormone therapy, including estradiol and perhaps anti-androgens for a period of 3 to 6 months, on that stable hormonal therapy, their laboratory values, including their CBC, certain chemistries, certain liver tests, certain cardiac profiles, will actually be reflective of a cisgender woman, and vice versa for a transgender man. If they are on stable testosterone or other androgen therapy, after a period of 3 to 6 months, their laboratory test values will also reflect that of a cisgender man. And for the physician at that point, what they are now treating is they treat that patient based on the values, and so they would use the analogs for a cisgender man for that transgender man if they've been on the hormonal therapy for 6 months, and for the transgender woman on hormonal therapy for 6 months, they will use the analog and schemata for a cisgender woman for certain tests. In regards to the question about cancer, yes, so in terms of prostate cancer for a transgender woman, curiously enough, one of the therapies for prostate cancer in cisgender men is actually hormonal therapy. So if a cisgender man does not get their prostate removed for prostate cancer, one of the treatment options is actually anti-androgens and estrogen, so which is actually very similar to the therapy given for transgender women who want to medically and pharmaceutically transition. So in that sense, what we're now learning is that the screening guidelines for cancer among transgender individuals with certain organs, so a transgender man who still has a cervix, we will still follow the recommended cancer screening guidelines for anyone with a cervix, including cisgender women and non-binary individuals with a cervix. For individuals with a prostate, regardless of them being a transgender woman, we will still follow the regular prostate screening guidelines that we have established for cisgender men. In terms of breast cancer, for transgender women on hormonal therapy who have undergone breast development, we are seeing emerging data suggesting a mammogram and other breast cancer screenings in transgender women similar to cisgender women with breast development. So the data in the medical literature is emerging, but we are seeing these changes in the treatment, in our understanding of the treatment, and how these hormones are actually shifting our paradigm of treating, and how we're actually essentially now melding the two of understanding of the cisgender hormonal profiles and how they can actually be applied to the transgender population after a period of stable hormonal therapy.
And thank you for your testimony. Senators, any other questions for any of our witnesses? Thank you each for being here. Thank you very much. You're excused.